Minister Maria Caulfield.
Thank you, Madam Deputy Speaker. Can I start by thanking the honourable members for North Shropshire and Sheffield Hallam, and I know the honourable member for Sheffield Hallam couldn't be here this afternoon, but she's done a huge amount of work over the last 12 months since the last debate, but also to the honourable member for Truro and Falmouth, who's the co-chair. It's a fantastic example of cross-party working on such an important issue to women, but also men up and down the country, and just to pay tribute for the work that the all-party parliamentary group does. They're tireless campaigners for improving support for all families who go through the heartbreak of losing a baby. Now, this is the 21st Baby Loss Awareness Week, and the 8th consecutive year this House has held a debate to mark it. And I'm proud once again to be able to applaud all campaigners and charities and clinicians who mark Baby Loss Awareness Week. And I will just use my time this afternoon just to update on progress we have made since the last debate last year around pregnancy loss in particular. But before that I do, I just want to touch on the comments made by the honourable member for East Worthing and Shoreham, who's my neighbour as well, and just really to apologise. While we have delivered most of the changes in his Act, we still haven't published the consultation on coronial investigations into stillbirths. And I know from speaking to Bill Kirkup and to Donna Ockenden, they are very supportive of coronial investigations into stillbirth, and I've met with many parents who've suffered the horrendous experience of losing a baby, who are very supportive of this change as well. And I was hoping to come to the dispatch box today to be able to make a positive announcement. Unfortunately, I cannot this afternoon, but I can give him an assurance that I'll personally follow this up after the debate, and hopefully in a very short period of time we'll be able to make a positive announcement for him. Now, the loss of a baby is tragically a common outcome. We are improving rates. Stillbirth rates have reduced by 23%, and neonatal mortality rates for babies born over 24 weeks gestation have reduced by 30%. But that is no consolation to those parents who experience baby loss when it does happen. And we know that too often when baby loss does occur, that the experience of parents and families is not what it should be. And that's why the Independent Pregnancy Loss Review published its review in July, and the government is supporting the recommendations in that report to make sure that every trust offers a consistent, compassionate service. And the review made clear that baby loss is often treated too often as a clinical event, with emotional support falling short on a number of areas. And that's why it's so important that we reintroduce compassion as an element throughout the experience. To take one example that was shown in the Pregnancy Loss Review, I was horrified to read stories of women miscarrying at home, storing their baby's remains in their fridge in a Tupperware container because they were waiting days for their early pregnancy loss unit to reopen. The review has put it down in black and white that major improvements are needed, and that is why we're supporting the recommendations. They made 73 recommendations for change within the NHS and wider society, and we have started action already on many of those. The first of which, and it was touched on by the spokesperson from the SNP, around the use of baby loss certificates for those babies who are born before 24 weeks who currently cannot be registered. And we announced in July that we will be rolling out baby loss certificates. They will be retrospective. There is no time limit on applying for them. They will be voluntary, so parents do not have to do one if they do not feel that they wish to. And we are going through service user testing with families to make sure that the system we set up works for them. But following testing, there has been some service specification that we need to improve on to make sure that this process runs smoothly. And it will be run on the gov.uk website. And once we've got those safeguards in place for both parents to be able to register on a certificate, we will announce the rollout date formally to this place, Madam Deputy Speaker. But it's important that parents who want to acknowledge the loss of their baby before 24 weeks are able to do so. We also looked at the sensitive disposal of a baby after pregnancy loss, many of which happens at home rather than in hospital and clinical settings. And it's important that women have access to proper collection facilities. So we've taken on board the recommendation of creating a bespoke receptacle to ensure that fetal remains can be collected and stored with due dignity. And to do this, we've been engaging with charities, with women, with healthcare professionals, and we aim to finalise the specification by February. We're also working with the Human Tissue Authority to review and update their guidelines by March next year. And NHS England is also consulting on a clear pathway to ensure that women can always have access to cold storage in NHS facilities too. Now, we also have heard from women that the difficulty they often experience in getting help during a miscarriage. So in partnership with NHS England, we're exploring how 111 and ambulance services can block book appointments with early pregnancy assessment units, so women in need can be directed straight to them if necessary, rather than going to A&E or to other healthcare professionals and going straight to their early pregnancy assessment units where care can be provided with dignity and privacy. Secondly, the review is proposing introducing graded care for women who suffer 1 or 2 or more miscarriages, and I know the Shadow Minister touched on this herself. And we have taken on board the recommendations because currently women have to suffer 3 miscarriages often before they get help. Now, Tommy's Miscarriage Centre at Birmingham, at the Women's Hospital there, have launched a 3-month pilot of this graded model so that after 1 miscarriage, assessments can be delivered. And I've been to the unit to see the amazing work that they do, and I'm looking forward to their results, where they will be looking at this graded model and be able to present to us the difference that this will make to women experiencing baby loss, and it will help prevent further pregnancy losses in the future. Now, one of the other recommendations that was made by the Pregnancy Loss Review is often that families are forced to grieve in public spaces. And I want to be really clear about this, that very often the pregnancy facilities themselves are inadequate. And I think I heard from my honourable friend, the honourable member for Truro and Falmouth, talking about the Daisy Centre that's now available in her area that wasn't available when she tragically had to go through her experience. Because in many places, clinics, units, buildings are just not able to meet women's needs. And so NHS England are surveying pregnancy facilities and will report back to by the spring to make sure that we can invest in those facilities to improve the outcome and experience for women and their families. We also need to improve support for bereavement for both the women and their families as well, and that's another key area that we are looking at as well. Now, a number of people touched on the amount of midwives that there are, and I'm really pleased that in Cornwall there's a waiting list for training, but across England there has been an increase in the number of midwives, 14.2% more than in 2010, and we are engaging in a number of routes into midwifery. We have the degree apprenticeship now, but we also have the nurse conversion course, which is pretty popular with nurses who perhaps want to work in midwifery instead of nursing. And we are seeing those routes not just get more midwives into practice, but retaining them as well. And that's a key element to be able to deliver all of the asks in the pregnancy loss review. We're also looking at how we support people in the workplace, and it's really important that women and families that experience baby loss are able to take the time off that they need. And as a first step, the Department of Health and Social Care has signed the Miscarriage Association Pregnancy Loss Pledge, and we encourage other organisations to do so. Now, Madam Deputy Speaker, I know that we could cover a number of issues that were raised on the debate, but I just want to be clear with the House that all of the issues that have been raised, whether it's the ongoing ongoing maternity inquiries, we have set up a National Oversight Board so that all the recommendations, whether it's Donna Ockenden, whether it's Bill Kirkup, whether it's other inquiries that have happened in the past, that we pull together all those findings and we make sure that every single maternity unit across England is responding to those recommendations, whether they're relevant to their unit's experience or not, because we want consistent good maternity care across the board, whether that's the birth rate plus model for ensuring there's more midwives on units, whether it's ensuring that the capital framework of the unit is able to help support women who lose their babies, or whether that is ensuring that the culture of change, which Bill Kirkup touched on so much in his review, is rolled out so that women have a compassionate experience when they go through the devastating loss of a baby. It's our duty to support families who experience the devastating loss of a baby, and this government remains committed to implementing all the independent pregnancy loss reviews recommendations. And at the debate next year, Madam Deputy Speaker, I hope the Honourable Member for East Worthing and Shoreham will have a more positive comment to make, and that we'll have addressed his concerns in detail, but also that many of the issues I've raised today, some of the work we've started the pregnancy loss review, will have taken a step forward. Thank you.